everyone. My name is Hayley Likens. My project partners, Nathan Brusher, Katarina Riker, Sarah Young, and myself, did our project on the nutritional implications for weekend warriors with osteoarthritis. I'd like to go over a brief summary of the abstract with you. The purpose of this report was to evaluate the nutritional requirements for adult weekend warriors with osteoarthritis and to provide them with recommendations that enhance physical activity. For this report, weekend warrior was defined as an adult individual who partakes in recreational and occasionally competitive physical activity. EBSCO hosts and PubMed databases were searched for research involving nutrition and osteoarthritis. The main finding of this research was that omega-3 fatty acids, animal-based proteins, vitamin K, vitamin D combined with calcium, collagen hydrolysate, curcumin, creatine, glucosamine sulfate, and chondroitin sulfate may all provide a positive impact on the management of osteoarthritis among active individuals. Key words for this study include nutrition, osteoarthritis, and weekend warrior.
Osteoarthritis is the most common cause of musculoskeletal disability in the older population. Nutrition plays a key role in prevention and management of osteoarthritis due to the known inflammatory component and decreased arthrokinematic stress loads on the joints with weight loss. The following slides review macronutrient requirements to prevent frailty, micronutrients, including vitamin K, vitamin D, dietary supplements, and performance-enhancing drugs to allow continued activity for the weekend warrior.
Frailty has been found to increase with age and is a contributing factor to disability and decreased function among the elderly. Of the three macronutrients, fat appears to be the easiest to manipulate for the treatment and management of osteoarthritis. Examples include fatty acids such as omega-3s and omega-6s. A proper balance of omega-3 and omega-6 fatty acids is necessary for a healthy diet. However, too many omega-6 fatty acids can have harmful effects on the body of those who suffer from osteoarthritis. It can increase the inflammation, pain, and the breakdown of cartilage within the joints, thus increasing one's risk of developing osteoarthritis. On the other hand, omega-3 fatty acids may possess anti-inflammatory properties, which helps keep the joints of the body healthy. With the correct ratio of omega-6 to omega-3 fatty acids, the progression of osteoarthritis may be delayed and the severity of the symptoms may be lessened. It is recommended that individuals keep their omega-6 to omega-3 fatty acid consumption ratios to 5 to 1 or less. Fatty acids that come from fish may significantly control inflammatory signals, thus decreasing joint pain and improving overall joint function. However, meeting recommended dietary allowances through diet alone is difficult. This is difficult due to the increasing presence of heavy metals and other environmental toxins in the fresh fish supply. Supplementing the diet with fish oils has been found to be a safer method of adding omega-3 fatty acids to the body. Due to aging, the adult population often experiences the gradual onset of weakness and the reduction of skeletal muscle mass, strength, cardiovascular function, and maximal aerobic capacity. Research shows that muscular strength gains are typically greater when anaerobic training is paired with a dietary intake of protein. The consumption of animal and soy-based proteins have proven to be more efficient in building skeletal muscle mass. Active adults who had consumed amounts of protein that were slightly above the RDA had significantly lower risk of frailty incidences. The removal of certain foods from the diet may also help those who suffer from osteoarthritis. Foods such as those that are considered to be genetically modified organisms, have high glycemic indexes, or contain grain-fed meats should be eliminated from the diet. The previously mentioned food items contain more omega-6 fatty acids than natural foods. Natural foods includes salmon, tuna, grass-fed meats, and flax seeds. The recommended dietary allowance for protein is 0.8 grams per kilograms of body weight a day. However, there is no set standard for recommended dietary allowances for fatty acids. However, it is recommended that 250 to 500 milligrams of omega-3s are consumed a day, while only 6 to 8 grams of omega-6s are consumed a day.
Micronutrients have also shown to be important in the management of osteoarthritis. The manipulation of certain vitamins and minerals may decrease the progression of OA among weekend warriors. This allows them to become more active in their elderly years. Vitamin K, vitamin D, and calcium are the three main vitamins and minerals that are the most important to managing osteoarthritis. Vitamin K is a fat-soluble micronutrient which is stored within the body. If these stores become low and a deficiency occurs, then there is an increased risk of developing osteophytes, bone marrow lesions, and subarticular cysts. These three conditions then worsen the symptoms of osteoarthritis. If an individual meets the recommended daily allowance of vitamin K, then supplementing their diet with vitamin K may not be beneficial for the management of osteoarthritis. Vitamin D and calcium are two other micronutrients that are important for the management of osteoarthritis in the weekend warrior population. Vitamin D deficiency has been linked to the progression of osteoarthritis. For this reason, a vitamin D supplement may be considered for those suffering with the disease. However, it is important to consider one's daily sun exposure and dietary habits before ingesting a vitamin D supplement. This is because vitamin D is a fat-soluble vitamin which is stored within the body. Research studies have shown that consuming a calcium supplement in combination with vitamin D may help increase bone mineral density and thus slow the progression of osteoarthritis.
Dietary supplements provide a safe and natural food supplement for weekend warriors without the non-desirable side effects that have been found in various pharmaceuticals, including NSAIDs. There are various types of supplements that may be beneficial for osteoarthritis. This may include collagen hydrolysate, curcumin, and creatine. Benita Ruiz-et-al. Found that recovery becomes optimal when the proper dosage of collagen hydrolysate is added to the body. One of the primary causes of osteoarthritis is collagen fibers in the cartilage breaking down due to the aging process, producing inflammation. Collagen hydrolysate provides amino acids, including hydroxyproline and hydroxylysine, to the body for utilization. Previous research has found that consuming 10 grams of collagen hydrolysate orally provided reduced joint pain and helped protect the cartilage from further degeneration. It was also associated with no adverse effects. Curcumin is a polyphenol extracted from turmeric and has been safely used in curries for years. It is an anti-inflammatory and an antioxidant, which are its primary functions, and this has occurred through regulating the biochemical and molecular pathways of the body by modulating molecular targets. The anti-inflammatory effect, comparable to NSAIDs, is due to the suppression of prostaglandin synthesis through the effect on cyclooxygenase and the inhibition of NF-κB activation. There are multiple studies that show curcumin is effective, although 180 milligrams over 8 weeks has been most effective, and it improved Japanese knee OA measures with decreased pain and stiffness, improved condition in daily life, general activities, and health conditions when initial scores were greater than 0.15. It has also been associated with no adverse effects, which makes it a great choice. Creatine use in the weekend warrior may improve muscle mass and overall function, which may lead to continuation of performance. The exact mechanism of action of creatine on osteoarthritis is unknown, although Neves and al. Found that older women who want to remain physically active with a decent quality of life can combine a physical fitness routine with creatine to reduce the negative effects of osteoarthritis on daily activities. The dosage varies by study, although the suggested dosage of 20 of creatine monohydrate for 7 days, followed by 5 grams per day for the next 11 weeks, is common.
Performance-enhancing drugs, PEDs. There are a few performance-enhancing drugs available for those who suffer from osteoarthritis. 2 such performance-enhancing drugs studied and found to be safe as first-line therapies for osteoarthritis are glucosamine sulfate and chondroitin sulfate. They were studied by the European Society for Clinical and Economical Aspects of Osteoporosis and Arthritis. Glucosamine sulfate. Glucosamine is a natural constituent glycosaminoglycans found in the synovial fluid of the cartilage matrix of the body's joints. Glucosamine sulfate decreases the inflammatory degenerative mediators in the body, thereby decreasing the pain. The preferred formula for the glucosamine sulfate is crystalline. It is preferred due to its prescription level strength. The recommended dose is 1,500 milligrams per day. Chondroitin sulfate is the first-line therapy for reducing osteoarthritis. It is normally taken with glucosamine. Both glucosamine sulfate and chondroitin sulfate should be taken under the direction of a doctor for proper dosing. Due to poor nutritional habits, the weekend warrior may have difficulty in obtaining recommended daily allowances of nutrients. These include proteins, fats, amino acids, vitamin D with calcium, and vitamin K. Collagen hydrolase, cumin, creatine, crystalline glucosamine sulfate, and chondroitin sulfate are safe supplements and performance-enhancing drugs that can be used to reduce or to slow symptoms of osteoarthritis and the progression of joint degradation. The last option the weekend warrior has is to evaluate their diets and reduce foods containing high levels of omega-6 fatty acids to reduce the signs and symptoms of osteoarthritis, particularly the inflammatory response to these foods. These foods include those with genetically modified organisms, foods with high glycemic indexes, and foods containing grain-fed meat.